Hello, I'm Nikita Chavan. Today's my topic is the respiratory system. The respiratory system is the structure of organ respiration. In body cells continuously use oxygen for the metabolic reactions that release energy from nutrient molecules and produce ATP. At the same time, these reactions release carbon dioxide. These systems can help to this system can participate in regulating blood pH. And then this system to contributes to homeostasis by providing for providing the for the oxygen for the exchange of gases, oxygen and carbon dioxide between air, blood cells and tissue cells. The structure the respiratory system consists of two types. There are two types. First is the upper respiratory system and second is the lower respiratory system. In upper respiratory system consists of a nose, nasal cavity, pharynx and associated structure, and the lower respiratory system consists of larynx, trachea and bronchi and lungs. Then then functionally the respiratory system consists of two parts. First is conducting zone and second is the respiratory zone. In conducting zone, contained parts are nose, nasal cavity, pharynx, larynx and trachea, bronchioles and terminal bronchs. Then respiratory zone consists are respiratory bronchioles, alveolar ducts and alveolar sacs and alveoli. Then branch of medicines that deals with diagnosis and treatment of disease of ear, nose and throat is called as orthoneurology. Then pulmonologist is a specialist in the diagnosis and treatment of disease of the lungs. In function of respiratory system is the provide for gas exchange, intake of O2 for the delivery of body cells and removal of CO2 produced by blood cells. The intake of O2 for delivery of blood cells and removal of carbon dioxide produced by blood cells. And then second is the help to regulate blood pH, to regulate temperature as well as pressure by the respiration. We take oxygen take oxygen, then the blood then the cells are exchanged the oxygen and carbon dioxide to maintain as the pH in blood. Then contain reports for the contains reports for the sense of smell. Filters inspired air produce a vocal sound and excrete a small amount of water and heat. Then the main part of the respiratory system is the nose. First are nose. Nose is divided into external portion and internal portion called as nasal cavity. External nose is the portion of nose visible on the face, consists of bones, hyaline cartilage covered by muscle, skin and lined. Then the outer is the inner line then external functions are the moisturizing and filtering. called as external nose. Then the nasal cavity, deep hollow cavity to stretching over the hard at the back. Then nasal cavity is a structure contains the roof, floor, medial wall, lateral wall, and posteriorly. The nasal then the pharynx is the long tube lines behind nasal and mouth cavities. And larynx, it belongs to both respiratory system. Pharynx is divided into three parts: nasopharynx, oropharynx, and laryngopharynx. Then laryngopharynx. Then respiratory system consists diseases are the like as asthma, difficult to take oxygen in patients, and treatment of this disease treatment of respiration related disease to respiratory system relates to as a meditation. Some as in asthma patient condition take pump for to help take sufficient amount of oxygen to increase rate of respiration. Then mechanism of respiration is as at rest, an adult breathes respiratory rate of 12 to 14 breaths per minute, and the amount of air inspired for expired per breath is approx 500 ml. Thus 6 to 7 liters of air is breathed in or out of the lungs per minute, called as pulmonary ventilations. Thank you.